examples of exam questions when I lecture. When we look at the appendicular skeleton, it's all the appendages. There are there's two girdles to kind of keep in mind. Pectoral is up top, right? The shoulder girdle. Pelvic is basically down below. It's the hip. Make sense?
Yes.
Okay. So the upper limb to the trunk, lower limb to the trunk as well. If we start with the pectoral girdle, what structures encompass this? You will not get any x-rays on the exam. You'll get images like this, right, that are simple. When it comes to the skull, I told you guys it'd be the colored skull. Do you guys remember the colored skull and the other one? So they're very, I would say, very easy pictures when it comes to the lab. For example, I could ask you, let's kind of go to this. You guys know this, right? You guys know what joint, we talked about this today with some groups. We've seen it before in the past. What joint is formed between the clavicle and the scapula? The acromioclavicular joint, because what bone on the scapula, particularly or specifically, is that point of articulation? The what?
Acromion.
The acromion, right? The acromion process. You can see that here on the x-ray, right? Here's the x-ray. This is lateral, right? This is medial, right? You guys know the sternum. You guys know the scapula kind of in the background here. This triangular bone here. Kind of draw it in real fast here for you guys. This way, that's the scapula. Again, no x-rays on the exam, but you should know how to, I don't know, I always like to give you guys clinical stuff so you guys are, competent when you guys do your rotations and can read an x-ray and talk the same language. But anyway, clavicle, flat bone. You can see that the larger part or fatter part, if you will, is medial, right? So that articulates with what bone? Sternum. What joint is formed? Sternoclavicular joint. We talked about the ACJ, acromioclavicular joint. Do you guys see this protuberance of bone on the anterior side, this little hook? What is that hook called? I'll give you this picture here. Give me the name of the picture, the name of the joint, the projection.
Glenoid cavity?
Well, the glenoid cavity is here.
Coronoid process.
The coronoid process. This hook, do you guys see this hook here? That's coming off the anterior side, correct? Okay. That hook, does it articulate with the clavicle? Yes or no? Does it articulate with the humerus?
Yes. I mean, it's connected.
Let's take a look.
Oh, yeah.
We just saw this. Does that hook articulate with the humerus?
Yes.
This is the humerus, yeah?
Yes.
This is the joint, yeah?
Yes.
Does this bone articulate
no.
with it?
Yeah.
No.
No. This bone does not articulate. That bone does not articulate with anything, right?
Don't keep saying no.
No.
I'm sorry.
Because otherwise, if it articulated with the humerus, we wouldn't have the glenohumeral joint, correct? We'd have the, what is this structure called again? We would have the coronohumeral joint or something like that. There's no articulation with the humerus, right? That hook that you're seeing there is kind of there for what reason? Muscle attachment. There's a muscle that we have called the coracobrachialis. The coracobrachialis is one of your muscles on the, what side? The medial side that helps with flexion. Why do you think it's called the coracobrachialis? Because its origin is what? The coracoid process. So it does serve a purpose for attachment, for muscles, but does it form a joint with the humerus?
No.
Is this an exam question? These are exam questions I'm giving you guys, right? So I want you guys to, like, again, how would I format this as a question? It's not about memorizing, right? It's about formatting. What belongs where? Does it form a joint with something? Does it articulate with something? Is it standing alone, right? So does the what is this little hook thing called again? I forget.
Coracoid process.
Does the coracoid process articulate with the humerus?
No.
I like that now. Everybody's no. Okay? No, it does not. It's on its own. It's by itself. It serves, just like Brooke said, as an attachment site for muscles. If you want to be hardcore about it, you can actually say the short head of your biceps and also for the coracobrachialis. You got to know that stuff later for muscles? Yeah. Origin, insertion, innervation, function, all that stuff you got to know. So that's why muscles are a little bit more tricky. Okay? Bones are pretty simple. So looking at the humerus, the lateral part of the scapula, right? Not the humerus, but this girdle. The lateral part of the scapula forms what little cavity we said?
Glenoid.
The glenoid cavity, you can kind of see it here on the x-ray as well. And that glenoid cavity is going to articulate with what structure, what bone?
The humerus.
The humerus. Very good, okay? So that's an exam question too, right? So I could ask you that stuff, right? What joint is formed?
Glenohumeral joint.
Glenohumeral joint, right? Shallow cavity gives us what? Increased ROM, right? Your arm can move basically in any direction. What do you give up? Stability, right? Because what happens to this arm more often than happens to your hip joint? Dislocation, right? Okay, it makes sense. So again, if you see this image, you guys should be able to kind of discern all these little kind of structures here. Clavicles, I don't really ask too much about the clavicles. We've already talked about the joints that are formed. We talked about the sternoclavicular on the medial or lateral side. Medial side. The acromioclavicular joint is on what side? Lateral. Very good. I really don't ask about these other structures. I review them in the lecture, but no exam questions come from that. I'm not going to ask you about any fracture type of things here, diagnosing fractures and displacements and all that kind of stuff. You're going to see that throughout the presentation, but I'm going to focus strictly on anatomy. So here's the scapula, the anterior view. What is that fossa called on the anterior view? So you're seeing this whole entire fossa here, right? What is that fossa called?
Subscapular fossa.
The subscapular fossa. Guess what muscle attaches to that subscapular fossa? The subscapularis, or the subscapular muscle. So it makes sense, right? So like we've talked about before, if you know your bones really well, does that help you with muscles? Yeah. So I want you guys to relate that stuff. Again, anterior side, you guys see this little hook?
Yes.
Okay. Does that hook form a joint with the clavicle?
No.
Does it form a joint with the humerus?
No.
No. Very good. I like that. What is it for? Muscle attachment. Okay. Can you see the relationships here? Again, no x-rays on the test, but I just want you guys to understand the dynamics of how things look like on an x-ray. There's your clavicle. There's your acromion. You form the acromioclavicular joint. There's your coracoid process that has no direct articulation with any other joint, but it does serve as a site for muscle attachment. The glenoid fossa, right? Head of the humerus fits right into there. So the head of the humerus is going to be found on that scapular side, that glenoid fossa, so just keep that in mind. So posterior side. So what's unique about the posterior? How do I know I'm looking at the posterior scapula? Because this giant spine kind of traverses it. You guys see that? And it separates the scapula into little fossas, right? You have a fossa up top and a fossa down below. What is the fossa up top called? Supraspinous, or supraspinous fossa. So why is it called the supraspinous fossa? Because it's above the spine. Okay? There's a fossa below the spine that's called the infraspinous fossa. Guess what muscles attach here? The supraspinous muscle and the infraspinous muscle, or in Latin, the supraspinatus and infraspinatus. Okay? You can see also that on the lateral side, because this is medial, correct? And this is lateral, right? On the lateral side, the spine of the scapula is going to terminate into this kind of projection of bone, right? What is that projection of bone called? The acromion. Does that acromion articulate with anything? The clavicle, yeah, we just saw it. What joint is formed? The acromioclavicular joint. Okay? So do you see how you're relating bones together? How they fit together? I want you guys to take this approach when you guys review your stuff. You're putting things together. You're understanding the relationship between one bone structure and another. What's medial, right? Proximal? What's distal? What's lateral? What's anterior? What's posterior? It's really important that you guys understand that, because it's going to help you guys out big time later, right? Especially for the quiz. Okay? Here it is colorized for you, kind of separated out. You can kind of make sense of it. Again, supraspinous and infraspinous fossa. Here's your acromion. And again, coracoid process is on the anterior side that does not form any articulations with any other bones. We're going to look at this later with muscles. Don't worry about that. On the lateral side, shallow cavity. We talked about that already. The glenoid cavity, the glenohumeral joint. Also of interest to note, is right above and right below that glenoid cavity are these little tubercles. What's a tubercle? Like a tubercle is like a little rounded projection, right? A circular projection. That's what a tubercle is. It's rounded, okay? So you have a rounded projection up top and a rounded projection down below. So what are these projections called?
Tubercle.
Tubercles. So you have one above the glenoid cavity, so you call it the supraglenoid tubercle. You have one below, which is called the infraglenoid tubercle. Why are these important? What are these roughenings of bone? The posterior muscle that attaches to this is your tricep. The anterior muscle that attaches to this is your bicep. Okay? Do you have to know that for now? No. Just know supraglenoid tubercle, infraglenoid tubercle. Okay? And this is the way the muscles would look like, superimposed there. Okay? So again, anterior, posterior. You don't have to know that now, but later on you do. Again, no. I'm not going to ask you any questions on these clinical correlations. Upper limb. Let's take a look at these structures individually. Humerus first. Three segments or sections to take a look at. We'll review each one individually. So if I show you like an image like this, for example, like this one here or these here, we should be able to discern the major elements or parts to them. So again, this is proximal, this is distal. We should definitely know what those look like. We should know the head. We should note what the head looks like, right? This is the head. You guys see that on either side. I don't make a big deal about the neck here, anatomical versus surgical. It doesn't. This is not orthopedic class. It doesn't really matter. But just note that the end of the epiphysis here would signify the neck, essentially. What I would ask you is the difference between, or what is found here. Is it a trochanter? Most students I'll give you guys what they confuse it with. They confuse the trochanters with tubercles. So where are the trochanters found? In the femur, right? Where are these little tubercles found? Humerus. So again, a tubercle is a rounded projection, right? These are small rounded projections, if you guys notice. They're not that, insanely large or big. So you have this one that's up top. That's why it's called what? Greater. It's a little bit bigger. You have one that's a little bit below and a little bit smaller, which is called the lesser. Okay. Significance. What do you guys think? Muscle attachment. Okay. So muscles from the shoulder, from the upper arm are going to attach here. Okay. Are you guys comfortable with those definitions so far? You got the head, you got the neck, right? You got the greater, you got the lesser. You have a little ridge or groove between. What is that little ridge or groove called? I'm going to highlight it right here for you guys. This little guy right here. Intertubercular groove, because it's between the grooves, right? The thing about that is a tendon passes through there. The tendon of the bicep is going to pass right through there. You can kind of see it here. You guys see this right here? That right there is the intertubercular groove. So far so good on the proximal end. Any questions? Again, if you have questions, let me know. Like, I didn't catch that at a review. We can review. The shaft, the only thing that's significant about the shaft is that you do have what's called the deltoid tuberosity. What would attach here on the deltoid tuberosity of the deltoid muscle? Distally is more important. Distally, we have a couple very important structures. Let's kind of go through them individually. Number one, we can see that the bones kind of flare out. You guys see how the bone flares out? Okay. Does that form an articulation with the radius and the ulna below? No. Okay. It does not. These are called what? Epicondyles. Okay. Epicondyles. The epicondyles, you can see it here, right? The epicondyles are these guys right here. This right here. That doesn't form an articulation with the radius and ulna. What does? The capitulum and the trochlea. We know this, right? We know this. Those structures form the articulation. The epicondyles, do they form an articulation? No, they don't. You can see them here. Again, do they form an articulation? No. Where do they articulate? What structures? Capitulum and trochlea, right? So be aware of that. We also have a couple fossa. On the anterior side, we have two fossas. We have this little guy right here, which is called the radial fossa. And the radial fossa is going to be on the medial or lateral side? Lateral side. But L for lateral. That means that the coronoid fossa is going to be on what side?
Medial.
Medial side. So I already know the orientation of this bone, correct? I know what's going to go inferior to this. I know what is going to articulate with the capitulum inferiorly, correct? What bone? Radius, because I know the radius is lateral, okay? I know that the trochlea is going to articulate with what bone? Ulna, because that's going to be medial. And I told you that little secret, little trick. Trochlea, ulna. They both end in A, right, to make it even easier, okay? So the capitulum is a rounded circular structure, and the trochlea, kind of looks like a little H, right? That's what they look like. That's all. What face is this, or what am I looking at here? The distal end, anterior, posterior face. Anterior face. There's one last structure that's really important for us to know on the posterior side, and you can see it here, right? This really big fossa, which is called the olecranon fossa, okay? So these are major elements to kind of keep in mind and note when it comes to the distal end of the humerus, right? So I know the anterior side, and I know what the posterior side looks like, okay? So that's really important for you guys to kind of keep in mind, because the bones of the forearm are going to play a role in articulating with this bone here, right? So we have to kind of know that. So could I ask you a question like, the following structure is not found on the humerus? Okay, the following structure is not found on the humerus. Is the capitulum found on the humerus?
Yes.
Trochlea?
Yes.
Medial epicondyle?
Yes.
Greater trochanter?
No.
No,
Trochanter.
right? Yeah, greater So is that an exam question, kind of? Yeah. So if you know your structures, if you know your anatomy, really easy, right? If you don't know, they all sound kind of good, no? Trochanter, tubercle, greater trochanter, lesser tubercle. Is that on the humerus? Greater trochanter? No. Lesser trochanter? No. Okay. Lesser tubercle?
Yes.
Yes. Okay. And it's all highlighted for you guys.